Dr. Paul here. Last time this patient arrived, well, mother and son, with a giant wart on the edge of her toe. We applied the numbing cream, Emla's the trade name, it's a lidocaine mixture, and then did a very deep freeze on this wart. And now you get to see a follow-up, which I think I've warned in the past that when you do a deep freeze you can get a blood blister, and so actually we're fortunate enough to be able to show you exactly what a blood blister looks like. This is a fairly impressive one. Enjoy. Hey,
hello.
How you guys doing?
We're good.
You brought your teddy bear again. So you had a wart on the bottom of your foot, right?
Yeah.
And we froze it pretty hard?
Yeah.
Let's take a look. Okay, it's still pretty big.
And a little bit black.
A little bit black and dirty. I think that it's a little flatter than it was. I'm not sure. Would you agree?
I think a little flatter and maybe kind of shrinking a little
Shrinking
bit.
a tiny
you see
bit.
a little bit of a space.
Yep. So I think this is one that we may freeze again in a couple weeks. Yep. As for your foot, and what we have here is a blood blister. You can kind of see a purplish discoloration around. Oftentimes, and most times, blood blisters will actually be around and under the wart. And there's increased blood flow to the area. It's usually a good sign. This bleb right here, is that bothering you when you're walking or wearing shoes?
Well, I'm wearing not a shoe that covers it because I haven't wanted to create the friction. But,
Perfect.
But it's not painful this last week. It was only really painful the first week, but it just came and went.
Okay.
Now it's just a little itchy from time to time.
Yeah.
But I'm not scratching it. I'm just waiting, and it's changing a little bit too, that it's getting softer instead of it was harder before.
Right. Okay, so I would suggest you leave that alone.
Okay.
And it's gonna just sort of shrink away in time.
Okay.
The wart itself, the big wart there, looks to me like we may have to retreat at some point.
Oh no! I thought for sure it was done.
I thought so too, and maybe. Let's hope so.
Okay.
Give it another 2 to 4 weeks.
Okay.
Now we've got another wart to look at on your finger here. And remind me, did we freeze this one?
Yeah, we did.
Okay. So what's happening with this one is it's lifting up.
Mom.
Just take a look at this. Try to get a look at it. Oh yeah, it's sort of lifting up there. See that? And you're a hairdresser?
Yes, I am.
So that's catching.
Yes.
I can see how it would be catching. You know, there's certainly the edge of this is detached from the underlying skin.
I wish you could just
So we probably can cut off some of this without getting to blood.
Okay. Look at that.
There we go.
Wow.
So
Look at that.
that is off of there. That should help.
Yeah, absolutely.
That should help. We've got a tiny bit, if you want to take a file to that and just
Sure.
smooth that edge.
The hard skin that's closest to the nail. Yeah.
And when you come back in a couple weeks, we may have to refreeze
Because
one
of
more
that
time.
black part we can see on the outside.
Well, I'm just,
okay.
I'm not 100% sure it's going to totally go away, but it might.
Okay.
Did you want a souvenir?
No.
Souvenir for YouTubers? You were worried this was going to end up where?
In the potatoes.
In the potatoes. And you didn't want potatoes, cuz? Thanks for watching. I'm Dr. Paul.